What is vocal fatigue in transgender voice therapy? Imagine trying to hold a conversation after running a marathon. Your voice feels tired, strained, and maybe even a little sore. That's what vocal fatigue is like, but for your voice. In transgender voice therapy, it's common to experience this feeling after practicing new voice patterns. When someone is working to change their voice to match their gender identity, they often push their vocal cords in new ways. This can lead to tiredness, hoarseness, or a feeling of effort every time they speak. Vocal fatigue happens because the vocal folds, which are the vocal cords inside your voice box, are adapting to new ways of producing sound. For transgender women, who often aim for a higher pitch and different resonance, this means using muscles and breathing techniques differently than they are used to. If they try to do too much too quickly, their voice can become strained. This is especially true if they do not get proper guidance from a speech-language pathologist who specializes in transgender voice care. Trying to raise the pitch or change resonance without proper technique can overload the vocal folds. This overload causes tension, which leads to fatigue. If someone pushes their voice too hard without resting, they risk developing vocal injuries like nodules or polyps. It's important to listen to your body and recognize early signs of fatigue, such as a scratchy voice, a feeling of tightness, or a voice that feels weaker than usual. Proper vocal technique is key to avoiding fatigue. Working with a trained speech-language pathologist helps you learn how to use your voice efficiently. Techniques like flow phonation and resonant voice therapy focus on producing sound with less effort. Breathing exercises and relaxation methods also help reduce tension in the neck and throat muscles. Gradually increasing voice use and taking regular breaks are good habits. Resting your voice allows the vocal cords to recover and prevent strain. Monitoring your voice and noticing early signs of fatigue can help you adjust your practice. Sometimes, if fatigue persists, it's best to pause and seek professional advice before continuing. In some cases, surgical options are considered, but they are usually combined with voice therapy. Surgery can alter the vocal folds structure, but it does not replace the need for careful behavioral training. Overall, vocal fatigue is a common part of the process, but with proper care and guidance, it can be managed effectively. This helps ensure that your journey toward a voice that feels right for you is safe, sustainable, and comfortable.